I bring to you now methods of abortion. Abortion is one of the most commonly performed operations in America. There is an abortion taking place in the United States every 20 seconds. Since the 1973 Roe v. Wade Supreme Court decision legalizing abortion, more than 25 million babies have been aborted in the United States. 25 million is about 1/10 of our population. The number of babies that have been aborted in America since 1973 is 43 times greater than the total number of war deaths from World War I, World War II, and the Vietnam War. In addition to the 1.6 million souls aborted in the United States every year, there are about 40 million to 60 million abortions worldwide per year. At least 30%, almost 1/3, of all pregnancies in the United States now end in abortion. Among unmarried women, 61% end their pregnancies by abortion. Most abortions, 91%, are performed during the first 3 months of pregnancy, called the first trimester. They say that less than 1% take place after the 6th month. The two most common methods of abortion in the first trimester are suction aspiration and dilatation and curettage. 80% of all abortions and most abortions in the first trimester use the suction aspiration method, also called vacuum aspiration or suction curettage abortion. In this 15-minute procedure, the cervix is dilated with a series of instruments called dilator rods to allow the insertion of a plastic tube into the womb. The tube is connected to a vacuum apparatus. The fetus is sucked from the mother's womb into a jar by a suction more than 24 times the power of a household vacuum cleaner. When tissue is no longer observed flowing through the tube, the doctor scrapes the wall of the uterus with a sharp instrument called a curette to assure that no pieces of the fetus remain to cause infection. Suction may be applied again. In a dilatation and curettage abortion, called a D&C, the cervix is dilated or stretched. The abortionist inserts a curette into the womb and scrapes the lining of the uterus to remove the placenta and the fetus. The doctor then gathers the pieces into a basin or sucks them through a vacuum tube into a jar. I would like to play for you a video clip from the film The Silent Scream. It shows a first trimester abortion on an ultrasound screen. You will see a 12-week-old baby being aborted by the suction method. Dr. Bernard Nathanson, an obstetrician and gynecologist, narrates this segment. Dr. Nathanson co-founded the National Abortion Rights Action League, directed the largest abortion clinic in the world, and was responsible for some 75,000 abortions. He is now actively working to end legalized abortion in America. America, you need to see what is going on in the doctors' offices and abortion clinics of our nation. We've all seen the amateur videotape of LA police officers cruelly beating and kicking Rodney King. The footage focused national attention on the problem of police brutality and launched a Justice Department review of law enforcement violence across the nation. Police brutality has been going on for years, but it took that amateur videotape to galvanize the nation to do something about it. Footage of abortions must be shown if America is going to wake up to the realities of abortion. I made the decision to show keepers of the flame of life on earth an actual abortion because Saint Germain and Mother Mary and Jesus have called you to take your stand for the defense of life. You will not know or understand what you are defending if you do not know exactly what an abortion is.
Now, let's move to the action. We now see the heart beating here in the child's chest. The heart is beating at a rate of approximately 140 a minute, and we can see the child moving rather serenely in the uterus. One can see it shifting position from time to time. It is still orientated in this manner, and the mouth is receiving the thumb of the child. The child again is moving quietly in its sanctuary. Now, this shadow which we are seeing down at the bottom of the screen is the suction tip. We have colored the suction tip deliberately in order for you to discern it more clearly. But the abortionist has now dilated the cervix and is now inserting this suction tip, which you can see moving back and forth across the screen. You will note that as the suction tip, which is now over here, moves toward the child will rear away from it and undergo much more violent, much more agitated movements. The child is now moving in a much more purposeful manner. Its orientation changes from time to time. It is rearing again here. Now, the suction tip has not actually touched the child, even though the child is extremely agitated and moving in a violent manner. The child has now moved back to the profile view, and the suction tip is flashing once again across the screen. The child's mouth is now open, and we will see that again on a freeze frame in a moment. But this suction tip, which you can see moving violently back and forth on the bottom of the screen, is the lethal instrument which will ultimately tear apart and destroy the child. It is only after the fluid has been broken, the sac has been disrupted, that the tip will actually come against the child. But we can see the tip moving back and forth as the abortionist seeks the child's body. Once again, we see the child's mouth wide open in a silent scream in this particular freeze frame. This is the silent scream of a child threatened imminently with extinction. Now, the heart rate has speeded up dramatically, and the child's movements are violent at this point. It does sense aggression in its sanctuary. It is moving away. One can see it moving to the left side of the uterus in an attempt, a pathetic attempt, to escape the inexorable instruments which the abortionist is using to extinguish its life. Now, the heart has again perceptibly speeded up. We can time this at approximately 200 beats per minute, and there is no question this child senses the most mortal danger imaginable. The membrane has now been punctured, and the fluid has escaped. One no longer sees that large reservoir of fluid surrounding the child. But once the fluid has been drained off, the suction tip has now been firmly clamped to the child's body, and the child is being pulled in a downward direction by the abortionist's suction tip with the negative pressure applied to it, and the body is now being torn systematically from the head. The head of the child being in this direction here. I am now outlining the child's head. The lower extremities have already been lost, And we see the suction tip flashing from time to time in the screen as a typhoon-like series of echoes, and the child is being tugged back and forth as the suction tip has now been applied to the body, and the abortionist is exerting his traction on the child in this manner. The child's head is still discernible here. The body is no longer discernible. It has now been torn from the head. What we see now is the head itself with what is called the midline echo of the head and the spicules or fragments of bone. Now this head, which I'm outlining here, on this 12-week child is simply too large to be pulled in one piece out of the uterus. The abortionist is going to have to employ this instrument, the polyp forceps, in an attempt to grab the head. The abortionist will attempt to crush the head with this instrument in this manner and remove the head piecemeal from the uterus. The abortionist and the anesthesiologist have a secret language between them which shields them from the grisly reality of what is going on. The abortionist and the anesthesiologist together refer to the head of this child, which is now being sought, as number 1. And the anesthesiologist will inquire of the abortionist, "Is number 1 out yet? Are we finished?" We now see intermittently the shanks or blades of this instrument appearing in the image here. The head tends to float freely in the uterus. Here are the shanks or blades of the instrument coming across here. And the head is now being locked on by this polyp forceps, and the head is being pulled down toward the cervix. Now all we see remaining are simply the shards, the broken fragments, the pieces of tissue which document that there was once a living, defenseless, tiny human being here.
%9 of all abortions in the United States, that is 144,000 per year, are performed in the 4th through the 8th months of pregnancy during the 2nd and 3rd trimesters. 2nd and 3rd trimester abortions are performed by 3 different methods. The first is dilatation and evacuation abortion, called a D and E. It can be performed any time between the 4th through the 8th month of pregnancy. This procedure takes from 10 to 30 minutes. Dilator rods are inserted into the cervix to cause dilation considerably larger than is required for 1st trimester abortions. Since the baby's bones are calcified, the doctor has to use forceps with sharp metal teeth to grasp and then twist off the parts of the baby's body, removing them piece by piece. The baby's head is too large to be removed whole and has to be crushed before it can be extracted. Once the doctor completes the abortion, the nurse reassembles the body parts to verify that they have all been removed. Dr. Anthony Levantino, an obstetrician gynecologist who used to perform abortions, describes a D and E. As a doctor, you are sitting there tearing, and I mean tearing. You need a lot of strength to do it. Arms and legs off of babies and putting them in a stack on top of a table. The second method of abortion during the 2nd and 3rd trimesters is to inject into the mother a drug or poisonous solution that will kill the fetus. Hours later, the mother goes into labor and delivers a dead baby. 2% of all abortions in the United States use this method. The doctor inserts a needle through the woman's abdomen into her uterus. He withdraws some amniotic fluid through the needle and injects saline solution, prostaglandin, urea, or a combination of these to induce contractions. Saline abortions are performed between 4 and 7 months of pregnancy. In a saline abortion, the amniotic fluid that is removed is replaced with a hyperconcentrated saline solution made with sodium chloride, common table salt. When the baby breathes in and swallows the saline solution, he is literally poisoned to death. The baby struggles for over an hour and finally dies. The mother goes into labor within 24 hours and expels the dead baby. Sometimes a baby aborted in this manner is born alive. A few have survived and been adopted. Others born alive have been left unattended to die. A saline abortion is a very painful way for a baby to die. Internally, the strong salt solution causes the organs and tissues to hemorrhage. The baby's veins and arteries rupture, leaving large bruises on his body. Externally, the skin is burned as if the child were attacked with napalm. Here's how one mother described her experience with a saline abortion. I went in and I asked, "What are you going to do to me?" All he did was look at my stomach and say, "I'm going to take a little fluid out, put a little fluid in. You'll have severe cramps and expel the fetus." I said, "Is that all?" He said, "That's all." It didn't sound too bad. But what the doctor described to me was not the truth. Once they put in the saline, there is no way to reverse it. And for the next hour and a half, I felt my daughter thrash around violently while she was being choked, poisoned, burned, and suffocated to death. I didn't know any of that was going to happen. And I remember talking to her, and I remember telling her, I didn't want to do this. I wished she could live. And yet she was dying. And I remember her very last kick on her left side. She had no strength left. I delivered my daughter, whose name is now Charmaine Marie. She was 14 inches long. She weighed over 1.5 pounds. She had a head of hair, and her eyes were opening. One former abortion counselor recalled how she once got a call at 4 in the morning telling her that one of her saline patients was trying to commit suicide. She had seen the baby she had just aborted. She couldn't believe what she had done. A nurse who once worked in an abortion clinic said she finally demanded to be transferred from that post after her experience with one saline abortion. The nurse said that she was with a young girl who had started the process of a saline abortion when the girl delivered the baby. She said, "I caught the baby. It was crying, still alive. An LPN who enjoyed seeing abortions came up behind me and asked me what was I doing. And then she said, 'What we do here is this.' She started wrapping, smothering the baby with chucks and throwing it in the garbage. I pulled her hand away. I said, 'The baby's alive, it could still cry.' She said, 'No, no, this is nothing.' So she just wrapped it up in chucks and threw it in the garbage." Throughout the 1970s, the saline abortion was the most common second trimester abortion technique in America, but it is now rarely performed. Today, D&Es are usually used in later term abortions because, as one observer said, you never get a live baby from a D&E. D&Es also cause less pain and emotional trauma and are less expensive. Today, prostaglandin chemical abortions are widely performed in 4 to 8 month pregnancies. Prostaglandins are synthetically produced hormones. They are injected into the amniotic sac or applied to the uterine muscle, causing the uterus to vigorously contract and expel the baby. Live births are common with this method. What I could never understand about late-term abortions is why, if a woman has carried a baby that long, she wouldn't want to give birth to that child and give it up for adoption. The why is answered by the disinformation, the misinformation that is given by some who run abortion clinics. They want to do the abortion, they want to make the money, they want the least hassle, and therefore they are not going to tell a young girl who is burdened what is really inside of her and what is really going to happen to that baby. A 7-month baby can live. Why doesn't the state take action? Human governments have existed since Noah to defend life. Why doesn't the state care for the young woman and take that child and see that it's adopted and cared for? Why don't we give support to women of whom Jesus spoke when he said that they are mothers of the universe, mothers of the human race? I believe that we could reduce abortions in the United States today by a large percentage if all high school children, junior high children saw these films and understood this message, especially the part about the soul and the reincarnation of the soul and life as a continuum. You will find that the network news and most TV stations refuse to show these films. You make your own judgment as to why. The third type of late-term abortion is a hysterotomy. It is performed at 6 to 8 months of pregnancy. The procedure for a hysterotomy is the same as for a cesarean section. The baby is removed from the uterus through an incision made in the mother's abdomen. The baby is almost always born alive and is subsequently killed by exposure or by suffocation because the mucus is not removed from his nose and throat to allow him to breathe. You saw in that beautiful birth scene that the midwife or the doctor immediately used suction to pull the mucus out of the baby's mouth and nose so the baby could expel the water that is in its lungs until birth and could begin to breathe immediately. They simply neglect to do that and wrap the baby up in plastic, a perfectly viable baby at 8 months. I do not understand how life has grown so insensitive as to be able to discard a human being who has the opportunity to live. One obstetrician observes that the infant who is removed from the womb during a hysterotomy is only sleeping like his mother. She is under anesthesia, and so is he. You want to know how they kill him? They put a towel over his face so he can't breathe, and by the time they get him to the lab, he is dead. One nurse whose job entailed helping with births as well as abortions tells the story of how she rocked a fetus in her arms, an aborted fetus which she said had been warm and breathing, one which she would ordinarily put in an incubator, but now was supposed to go into formaldehyde. It's a simple decision of the parents. If they have a premature baby and they want the baby, it goes in to an incubator, is cared for, and it lives. If they want to abort the baby is let die and put in formaldehyde for research or the use of its organs, whatever. Why? Why is our nation so heartless toward life? I think that this insensitivity must be brought to the attention of people, and I know of no other way than by intense decrees to Almighty God. As far as I am concerned, the pro-life movement is an abysmal failure, and I personally do not want my name associated with it. I am going to deliver the message of the Ascended Masters, and you may elect to do the same, because without their teaching, without the understanding of life, which I have not concluded in its telling this evening, people are not converted to the sacredness of life. The pro-life movement does not have the spine to carry the day. And therefore, the chelas of the Ascended Masters must do their work as chelas and not compromise the message. You will be amazed at how many people will hear the message of the soul and of the four lower bodies and of reincarnation and of identity and of where that soul is prior to conception, preparing to enter that body. This is the message that people have to hear. And if you think that people won't listen and won't believe it, believe me, they will. They are waiting for that message. They know it in their hearts and in their minds. They need you and me to tell them the real reason why we do not abort babies. And I tell you this out of long experience with the pro-life movement. We have to speak independently of that movement, because people who are for abortion, nice people who have been hoodwinked into its logic, are not listening to the pro-life movement. They do not have credibility. Only among themselves do they have credibility. And that is my position, and it is absolutely essential to take it, because the real reason is that reincarnation and karma is there. And people must know that they will be seeking the portals of birth themselves in their next embodiment, and that we have an accountability to keep life reincarnating, and that this is God's plan. They will know it, and they will believe it. I have already had people who have read only a few pages of the Astrology of the Four Horsemen and the short section I have in it on abortion. Reading those few pages that clearly state the real reason why we guard life, people have written and told me they were converted and they would never be for abortion or for pro-choice again. That message is powerful. Saint Germain's message is powerful, and you need to be willing to speak Saint Germain's name and Mother Mary's name and Jesus' name, and speak of these truths of life and these facts, and not copy the pro-life people. They want nothing to do with me and this church. They have already rejected us many years ago, rejected our Soul That's Free film, because many of them are Christians and will not have that kind of teaching of a soul reincarnating as a part of their pro-life movement. So let us not make the mistake again of thinking we are going to join on their bandwagon and then conceal our beliefs because they are unacceptable to them. This is unacceptable to me, and it's unacceptable to El Moria. We have to tell the whole truth. We have to tell the whole truth and nothing but the truth, and not tell it in the fanaticism combined with the spineless way in which they deliver this message. I tell you truly, independently, paddling our own canoe, we will make our statement, and our statement will be heard. Thank you. Won't you be seated? We have quite a few more facts and details to deal with here, all of which you need to know. This is information you need to have. When someone is coming to you because in their souls they know abortion is wrong, but they don't know why, and they want you to give them a very good reason why they should not have an abortion. And you need to have many reasons and many appeals, because they do not all appeal to everyone. And the following is information that you also need to know. There is a lot of controversy over a new form of abortion that so far is not available in the United States. It is a pill called RU-486. RU-486 blocks the action of progesterone, a hormone necessary to maintain the nutrient lining of the mother's uterus. The baby is effectively starved to death. RU-486 is being researched in many countries but is currently in use only in France. Non-profit organizations in Britain, Sweden, and the United States have all shown interest in purchasing RU-486 at a minimum cost and distributing it in their home countries. In France, about 65,000 women have taken this drug. It is used to perform 1/4 of all abortions. This method of abortion is designed for women 4 to 7 weeks pregnant. Following a positive pregnancy test, a woman waits a week and then goes to an abortion facility. Here she is given 600 milligrams of RU-486. Within 36 to 48 hours, she usually goes into labor and delivers a dead baby. The woman returns to the facility in 48 hours for an exam. If she has not yet aborted, she is given prostaglandin to stimulate contractions. If the woman has not passed all of the placenta and the dead baby, she must have a D and C abortion. This occurs in 3 to 4% of the cases. If the woman is still pregnant after the RU-486 and the prostaglandin, she is encouraged to have a surgical abortion. This occurs in 1/10 of 1% of the cases. Following an abortion by RU-486, the woman usually experiences heavy bleeding for about 10 days, and sometimes for as long as 6 weeks. About 1% of the French women who have taken RU-486 have lost enough blood to require a transfusion. After the drug was approved for sale, there was an outcry from the pro-life movement, prompting officials at Roussel ou Claf, the French pharmaceutical company that manufactures the drug, to announce that the sale of the drug would be suspended. French Health Minister Claude Évin ordered Roussel ou Claf to make it available again, quote, for reasons of public health and in the interests of women, unquote. For the moment, the French drug company is holding off on pushing for the introduction of RU-486 into the United States. They are concerned that controversy over abortion in the United States will prevent the drug from being put on the market. On July 26, 1990, in a voice vote, the House of Delegates policy-making body of the American Medical Association endorsed testing and possible use of RU-486. Supervisors in San Francisco have endorsed testing the abortion pill, and officials in New York City, under the administration of Mayor David Dinkins, are evaluating a proposal to test the drug. If RU-486 becomes widely available, abortion could become an essentially private, self-administered procedure that could take place without having to go to a clinic or hospital. Abortion opponents argue that use of a drug like RU-486 conceals from the woman the reality that she is indeed killing her baby, and that it would limit opportunities for public oversight and regulation. Advocates welcome the drug because they say it will help end the stigma attached to performing an abortion. They also say it offers a less painful and safer alternative to other forms of abortion. Another abortion pill under development is liloprostone. Dr. Bernard Nathanson says, RU-486 is history. There is a new pill which is being developed just now called liloprostone. The investigators of liloprostone claim that the latest weapon not only kills the pregnancy, but also acts to expel it quickly with no need for prostaglandins and/or suction D and C. More chilling is their finding that if the drug is given very early in the pregnancy, 3 to 4 weeks, the entire pregnancy will be resorbed. That is, it will simply disappear, leaving no trace. There is no bleeding, no expulsion of tissue, nothing to identify this as an abortion. Out of sight, out of mind. Have an abortion and never be aware of the baby that you have killed. This is the most diabolical form of abortion yet. A new abortion technique that some women are trying is spiritual abortion. One nurse who conducts spiritual abortion sessions uses hypnotherapy to enable the mother to contact the spirit being of the unborn child within her. She writes, quote, "I found that women who had made the decision to have an abortion were able to enter a deep state of relaxation where they could communicate with the tiny being which they were carrying, explain why it was that this was not an appropriate time for them to bring this child into the world, and hear the response of this little one. After the conversation," the nurse says, "the fetus would make an agreement to leave. Within 3 days, nearly 100% of these women experienced a miscarriage." I would like to make a comment on this, and that is the following. It is important that prospective parents know that in all of the depths of their being, they want to have a child. Not wanting to have a child and not knowing that that not wanting is in you at some level, whether by fear or whatever reason, can cause you either not to conceive or to miscarry. That is how sensitive life is in the womb. The entire process of pregnancy is obviously directed automatically by the body. The subconscious and the unconscious are involved. Therefore, you see, whatever you deposit into those sub-levels of being where you do not have direct access will affect the child in the womb. So you must search your soul and heart and know that you do want the children you are bringing forth. They know when they are wanted and when they are not wanted. Sometimes a child is so strong and determined that he will come, wanted or not. But there are many children who will not desire to push through that opposition which they perceive they will deal with for the foreseeable future while they are under the care of their parents. Multiple miscarriages may not only be a biological or physiological problem, it may be a psychological problem on the part of one parent or the other. Therefore, if you are not married and are planning on getting married, it is very important that you know whether the person you are going to marry really wants to have children, if you do, and really wants to give the care and support and doesn't have psychological complications from his own birth and childhood or previous embodiments that make him or her not really want to have children, but feel that perhaps they should have children as a matter of duty or as a matter of pleasing their spouse. Now I would like for you to hear firsthand how some former abortionists and abortion assistants describe their experiences with different methods of abortion. Their testimony was filmed at a conference called Meet the Abortion Providers. The first doctor who is speaking is talking about the use of ultrasound by the abortionist.
The technology of ultrasound has the ability to open a window into the womb. When a woman sees her own baby moving on the screen, it has a profound influence on her, and I believe this is the technology which should be utilized as much as is possible. The abortionists also know that ultrasound can be a valuable tool in performance of an abortion for another reason. Dr. Sally Dorfman reported on the use of ultrasound during abortion at the annual meeting of the American Public Health Association of 1986. She recommended that it be used in all abortions performed after 12 weeks to accurately assess fetal age as a teaching tool and as a means of enhancing safety. It's interesting that they're doing all these things to enhance safety when it's such a safe procedure before they started using it. It is interesting also that she has warned against letting the patient see the image on the screen as, quotes, Seeing a blown-up, moving image of the embryo she is carrying can be distressing to a woman who is about to undergo an abortion. She stressed that the screen should be turned away from the patient. She also addressed its effect on staff members and stated that they may need opportunities for venting their feelings and for reconfirming their priorities. What they really need to do is to look at the moving image on the screen and realize that they're about to take the life of a living human being.
A lot of people don't know what abortion is about. They don't know what is being aborted, and they don't know how it's being done.
Clusters of cells, products of conceptions, or just plain tissue are all lies. I have been there, and I have seen these totally formed babies as early as 10 weeks, a couple inches long, with a leg missing, or with their head off.
I've perforated uteruses before. I've had all kinds of problems, bleeding, infection. Lord knows how many of those women are sterile now. I remember getting called down to my chairman's office because a young lady that I'd done an abortion on showed up, interestingly enough, in Troy, New York, where I now work. And the abortion had been incomplete. I hadn't done my job right. And she passed an arm or a leg, and she freaked out because she didn't realize what had happened.
I would work up there, and this woman forced her daughter to come in there, and she was a second trimester, probably about 15 weeks. And they had inserted the laminaria the day before, and she was in there, and she was miserable, that poor girl was. And she was really upset, and she kept going to the bathroom, and obviously there was something wrong with her physically. And when she went into the bathroom the next time, all of a sudden she started screaming at the top of her lungs, "It's a baby! It's a baby! Mama, mama, mama!" And she was screaming at the top of her lungs in the middle of our clinic. She's going to be scarred emotionally from having seen that baby in the toilet, because that's where it landed.
But one night, a lady delivered, and I was called to come and see her because she was uncontrollable. And I went in the room, and she was going to pieces. She was having a nervous breakdown, screaming and thrashing, and the nurses were upset because they couldn't get any work done, and all the other patients were upset because this lady was screaming. And I walked in, and here was her little saline abortion baby kicking. It had been born, and it was kicking and moving for a little while before it finally died of those terrible burns, because the salt solution gets into the lungs and burns the lungs too.
Baby's bones were far too developed to rip them up with this curette, and so he had to try to pull the baby out with forceps, which he brought about 3 or 4 major pieces, and then he scraped and suctioned and scraped and suctioned, and there this little baby boy was laying on the tray, and his little face was perfectly formed, just like the sign you saw, perfectly formed. Little eyes were closed and little ears, and everything was perfect about this little boy.
There was one incident where a white piece came out, and I asked the doctor later on what it was, and it was the baby's skull. And I can still, to this very day, hear the crushing noise of that baby's skull being crushed.
I remember another experience as a resident on a hysterotomy. Well, that was kind of exciting to me to see a cesarean on a baby that young, so I helped on that surgery. And I remember as we made the incision and got in and made the incision in the uterus, to see the baby move underneath the sac of membranes as the cesarean incision was made before the doctor broke the water. And the thought came to me, my God, that's a person. And then he broke the water, and when he broke the water, it was like I had a pain in my heart, just like when I saw that first suction abortion. And then he delivered the baby, and I couldn't touch the baby. I wasn't much of an assistant. I just stood there, and the reality of what was going on was finally beginning to seep in to my calloused brain and heart. And they simply took that little baby that was making little sounds and moving and kicking over and set it on the table in a cold stainless steel bowl. And every time I would look over while we were repairing the incision in the uterus and finishing the cesarean and look, I would see that little person kicking and moving in that bowl. And it kicked and moved less and less, of course, as time went on. And I can remember going over and looking at that baby when we were done with the surgery, and the baby was still alive. You could see the chest with a moving as the heart beat, and the baby would try and take a little breath like that. And it really hurt inside, and it began to educate me as to what abortion really was.
There was this tremendous conflict going on within me. Because here I am, I'm doing my D&Cs 5 and 6 a week, and I'm doing salines on a nightly basis. Whenever I was on call, the resident on call got the job of doing the salines, and there'd usually be 2 or 3 of those. And those were horrible, because you saw one intact whole baby being born. And sometimes they were alive. And that was very, very, very frightening. It was a very stomach-turning kind of existence. We're going crazy trying to find a baby to adopt. And here we are, so we started desperately looking for a baby to adopt. And I'm throwing them in the garbage at the rate of 9 and 10 a week. And it even occurred to me then, it's like, I wish one of these people would just let me have their child. But it doesn't work that way. We were lucky. Still took 4 months. We had adopted a healthy little girl. And we were satisfied. We called her Heather. As I said, my reasons for quitting were a lot more personal, but maybe, I hope, you can draw something from it. Life was good until June 23rd, 1984. On that date, we had, I was on call, but I was at home at the time, and we had some friends over, and our children were playing in the back of the yard. And at 7:25 that evening, we heard the screech of brakes out in front of the house. We ran outside, and Heather was lying in the road. We did everything we could, and she died. Let me tell you something. When you lose a child, your child, life is very different. Everything changes. And all of a sudden, the idea of a person's life becomes very real. It's not an embryology course anymore. It's not just a couple of $100. It's the real thing. It's your child you buried. And the old discomforts came back in spades. I couldn't even think about a D&E abortion anymore. No way. And then you start to realize this is somebody's child. I lost my child. Someone who was very precious to us. And now I'm taking somebody's child and I'm tearing them right out of their womb. I'm killing somebody's child. That's what it took to get me to change.
Can you see the willing sacrifice of Heather to save her father? I can see it. Both the advocates and opponents of legalized abortion agree that women who have abortions risk certain complications. The question is, how great is the risk? Pro-choice groups claim that a first trimester abortion is safer than childbirth. They say that only 3% of women having first trimester abortions experience complications. Pro-life advocates charge that these statistics are grossly inaccurate. They say women who feel shame or guilt about their abortions are naturally reluctant to report complications or come in for follow-up exams. The common immediate physical complications that can result from the suction, aspiration, D&C, and D&E abortions include hemorrhaging, tearing of the cervix, inflammation of reproductive organs, and laceration of the uterus. In most cases, these complications can be treated without long-lasting consequences. There are exceptions, however. At best, a tear in the cervix can be repaired with stitches. At worst, damage to the cervix muscle can cause miscarriages and premature births in future pregnancies. Or it can cause future babies to have a low birth weight and many other health problems. Bleeding after an abortion is usual, but in some cases, women have needed blood transfusions. Another danger is that the dilator or suction tube used by the doctor can pierce the mother's uterus. Sometimes the uterus can repair itself, but in some cases, the woman must undergo a complete hysterectomy, the removal of her uterus, and the possibility of ever having a child again. In saline abortions, a woman can die if the saline gets into her bloodstream. Cardiac failure, septic shock, hemorrhage, and inflammation of the membrane lining the abdomen are among the possible complications of a saline abortion. Saline abortions have been outlawed in Japan because of the high risk of death to mothers. In 1976, the United States Supreme Court decided, in the case of Planned Parenthood of Central Missouri versus Danforth, that a Missouri law outlawing saline abortions was unconstitutional. Each year, some women do die from abortion. The longer the woman waits to have an abortion, the greater the risk of death. Williams Obstetrics, the standard medical text, states that the relative risk of dying as the consequence of abortion is approximately doubled for each 2 weeks of delay after 8 weeks of gestation. The Alan Guttmacher Institute reports that there is 1 death for every 500,000 abortions when the pregnancy is 8 weeks or less, 1 death per 30,000 abortions at 16 to 20 weeks, and 1 death per 8,000 abortions at 21 or more weeks. In any abortion, if all the parts of the fetus are not removed, there is a risk of pelvic infection. Some claim this can lead to infertility. One of the major questions in the debate over abortion complication is, what effect does an abortion have on a woman's future pregnancy or ability to become pregnant? Williams Obstetrics states that fertility is not altered by elective abortion. The United States Center for Disease Control denies the claim that women who have had abortions will have trouble conceiving, develop ectopic, tubal pregnancies, deliver stillborn babies, or become sterile. However, there is much evidence to the contrary. Testimony before the United States Congress in 1983 included a report that 20 to 30% of all suction and D&C abortions performed in hospitals cause long-lasting negative effects primarily involving reproduction and fertility. A 1986 study of the effect of abortion on subsequent pregnancies showed that forceful dilatation of the cervix by any procedure, whether in a first or second trimester abortion, predisposes a subsequent pregnancy to increased risk. Other studies indicate that the abortion of a first pregnancy causes complications with future pregnancies, increases the chances of miscarriage in the first and second trimester, and increases the chances of premature births and deaths among newborns. When the cervix, uterine wall, or delicate fallopian tubes are harmed, the risks increase for ectopic pregnancies, infertility, and other problems in labor, delivery, and carrying a pregnancy to term. The United States Department of Health and Human Services reported in 1984 that there has been a 300% increase in the United States in ectopic pregnancies since 1973, the year abortion was legalized. In an ectopic pregnancy, the fertilized ovum develops outside the uterus, for instance in the fallopian tubes, and the baby cannot live. Researchers have also found that among women who have had 1 abortion, there is a 500% increase in ectopic pregnancies. Williams Obstetrics states that multiple induced abortions increase the risk of a future ectopic pregnancy. The risk is unchanged after one induced abortion, but doubled after 2 or more. One reason abortion may cause ectopic pregnancies is that if the curette scrapes across the fallopian tubes, scar tissue forms and may cause partial or total blockage of the tubes. If the tube is partially blocked, the sperm can still enter the tube and fertilize the ovum, but the embryo may be too large to get through the tube into the uterus. Studies in Poland found there was a 6.9% infertility in women who had had abortions. In Latvia, there was 16% infertility following an abortion. In Greece, there was 45% infertility following an abortion. One doctor who has treated women who have had abortions says that without a doubt her patients had complications afterwards, and some that were long-lasting. I would normally see them once every 6 months for a repeat contraceptive prescription, for instance, nothing too much. And suddenly after the abortion, I would see them about every second week and sometimes even weekly with some other new symptom. I noticed that if a patient of mine had an abortion, within 24 hours to about 2 weeks, it was very common for her to suffer such illnesses as a bladder infection, a kidney infection, a pelvic infection, ovary or uterine problems. You could almost guarantee it. Within a week or so, you'd see them back with something else. It was not uncommon within a few months to find them developing other illnesses that they had not had before, such as anemia, a feeling of depression, a feeling of anxiety, problems with periods. A doctor who worked in Australia at a hospital that had an in vitro fertilization program says that many of the in vitro fertilization patients who could not conceive due to blocked tubes had had several abortions. I can tell you that I have noticed, because I receive the hearts of women who have had abortions or men who have assisted in the decision for women to have abortions. And I have taken note of the fact that people who have told me they have had abortions have had complications in getting pregnant or have never been able to get pregnant again. They have become infertile for no apparent reason. But I myself have observed this as a statistic that I've seen for the last 30 years, especially since 1973. The complications of abortion are not limited to physical effects. In the aftermath of an abortion, many women must deal with the emotional consequences. The after effects of abortion are called post-abortion syndrome, or PAS. A woman may suppress her responses to the abortion for years. One counselor who treats women with post-abortion syndrome says, the crisis point occurs most often between 2 to 5 years after the abortion. For some women, the crisis may come within months of the abortion. For others, repression may last 20 to 30 years or more. The most common effects include guilt, anxiety, depression, intense grief, anger, suicidal urges, drug and/or alcohol abuse, sexual problems, nightmares, lowered self-esteem, and development of eating disorders. The National Abortion Federation minimizes these effects. In its fact sheet on the safety of abortion, it states, some women feel sad or weepy for a few days or weeks afterwards and may find it helpful to talk about their experience with a family member, friend, or counselor. These feelings of loss, however, should not be confused with regret. Most women also report relief at having ended the pregnancy and are satisfied that they made the right decision for themselves. End of quote. Health practitioners and psychologists who have worked with these women often have a different story to tell. Although no one knows for sure how prevalent psychological problems are among women who have had abortions, there is no question that for some, they have been devastating. One abortion doctor and psychiatrist who performed more than 20,000 abortions says, there is no question about the emotional grief and mourning following an abortion. It shows up in various forms. I've had patients who had abortions a year or two before, women who did the best thing at the time for themselves, but it still bothers them. Many burst out crying. A psychological price is paid. Another doctor says, I saw many women who had not only physical problems after abortions, but also psychological and emotional problems, many of which were fairly deep-seated. I've had patients who had abortions even 20, 30 years ago. When they came in for a regular pap smear, they would tell me that they had had an abortion 25 years ago, and they still regret it to this day. And then they would tell me about the gnawing pain. One midwife says that when she is taking her patient's history of past surgeries, every woman who has had an abortion cries as she tells of the experience, even if it is 10 years or more afterwards. They all vividly remember the experience and still live with the guilt, no matter who tells them to let go of the guilt. They have long-lasting regrets. Listen to the testimony of these 5 women who experienced intense trauma following their abortions. When I was 16, I was shuffled through an assembly line abortion. I was number 13 of 17 who went through the morning session at one abortion clinic. Physically, I had no problems with my abortion, but emotionally, I created a living hell that continues on a daily basis. I'm not sure the tears will ever stop. I've been waiting almost 11 years now, and they never seem to cease. It's difficult to lay my head down at night, knowing I chose to allow someone to invade my body and remove my child. If I had known then that it would be difficult to sleep at night, and that every time I saw a child about the same age as the one I got rid of, my insides would flinch, or that I would feel I had to have another child to justify my actions as a teenager, hopefully I would have made another decision. When you hear about the complications, the psychology, the emotions, the dealing with the entire situation, you can see that it is a lot more trouble in a given lifespan of a woman to have an abortion than to go through the inconvenience and the sacrifice to bring that baby to term, even if it be public disgrace or being ostracized by the family, etc. You can see how the woman who brings that baby to term has made her peace with life, with that child, can give it up for adoption or keep it. But the alternatives to giving birth to your child are truly the agony of hell. Since many of these people are not able to give decrees or the violet flame or to understand that there's a discarnate involved, they can be grieving because that child has never left them. I can remember, before I was ever married, a little soul, a little boy about the age of 6, would follow me around. He would sit down. If I sat down to eat, he would sit at the table and look at me. This is the only experience I've ever had with someone who wasn't an ascended master. So I would look at this little blonde boy with blue eyes, and I would say to him, I'm not in a position to have a baby. And he kept following me around. Eventually I was married to Mark, and he was still there. And when I thought about where he came from, I remembered where I had picked him up. I went to Switzerland when I was 17, and I went to a performance of an operetta of a very high vibration, and I remember that I was exalted at this particular event. It was performed in German, and yet when it was over I had understood every word of it. And I realized that it was on that occasion that this soul attached himself to me. And so when the time came and we had our first child, I realized that that first child was this little boy who had been with me as such a gentle presence, not pestering me, but simply always wanting to be near his mother, and finally he was born, and that was our Clare Prophet. So he was with me from the age of 17 until he was born when I was 24. So you can see how the planning of God and of life takes in many years and many lifetimes and past associations, and how God even arranges for us to pick up souls and to go to the place where they perhaps lived or they passed on, and they are still there. And that has happened with my other children also. And so to realize that there is such a grand design, such a master plan to our lives before we are even born. As I said before, God has planned our children and our grandchildren and our great-grandchildren. And to think of the bliss and the joy of carrying children. I myself can tell you I have never felt more useful in my life than when I have been carrying my babies and giving birth to them, because I always felt unique in the universe, that God had chosen me to have this specific child for a very special reason. And I felt unique because God wanted me and me alone to have this child, as I know He selects every father and mother to have a very special life stream for a special purpose. And so I have never felt my uniqueness in such a wonderful way as I have felt it in giving birth to children, and now in nurturing all of life and caring for so many, many souls. And to think of its opposite in pain, because the nation has been saturated with such disinformation, grieves me profoundly, because women are truly being deprived of fulfilling their calling, and men are being deprived of the great joy of experiencing the siring of the sons and daughters of God. So I have a few more of these young women. You've heard the words of two. This is the third. I didn't receive any formal counseling at the clinic. They simply described the suction abortion procedure and said it would take only a few minutes. Those few minutes scared me for the rest of my life. If only someone had been there to give me the facts about the child inside of me, I could have been spared the haunting grief and guilt that has followed me ever since. The next one says, I felt so sad and alone after my abortion. I began to die that day. I couldn't drink enough. I wanted to be numb. I wanted another baby so badly. Another one said, I had severe depression. I contemplated suicide. I have horrible nightmares about babies and people trying to kill me. Another one says, I was so angry I punched out windows with my fist. I hurt so much inside I had to hurt myself physically to release the pain. I tried suicide twice.